morning. My name is Hisham. I'm a general surgeon and surgical oncologist. I'm head of the general surgery section in Department of Surgery at St. Joseph's Hospital. Well, thyroid cancer there are 4 or 5 different types, but about 90% of the cancers fall into 2 major types. And 80% of that is actually just one type of cancer that's called papillary. The other most common type is follicular. The important thing to remember is that thyroid cancer is very treatable, and very few patients actually die from thyroid cancer, even if it's discovered late. Most patients with thyroid cancer are discovered by chance or because there's a lump that they feel in the neck. At that point, it's usually a large tumor. If you start having symptoms, that usually means it's either advanced or it's one of the bad types of cancers, which are extremely rare. So the symptoms to look for in any advanced thyroid cancer would be hoarseness, changes in voice, pressure in the neck, pain on swallowing. These are advanced features that are, again, very, very rare. Most of the time, these are actually symptoms of something else, like a sore throat or a cold. So the usual way it's discovered is either by accident, because some x-ray has been done to look for something else, or because someone feels a lump in the neck and they want to investigate what that is. The main treatment for thyroid cancer is surgery, particularly the 2 most common kinds. There are very, very special, unusual circumstances when you have to do other treatments, but that's only if surgery is not possible. And the main surgery, and that's controversial and depends on the type of cancer, how big it is, and which side of the thyroid gland is involved, usually means removing the whole thyroid gland. There's controversy. Some people say depending on the size, depending on the type, you only need to remove one side and watch the other side. But in general, it's either removing one side of the gland or both sides of the gland. Most people do very, very well with thyroid surgery. A small incision is made in the middle of the neck, just above above that little divot in your neck. And the side effects of the surgery are minimal. People usually go home either at the end of the day or the next day. There's minimal pain in the incision. Usually what happens is you have some hoarseness after surgery because we're manipulating the neck. Sometimes you have a little bit of difficulty swallowing. Most of that gets better fairly quickly.